Hello, Wesleyan community. As we gather, I would like to invite Michael Bartley, Wesleyan's Director of Spiritual Life, to open us in prayer.
Let us pray. Eternal and gracious God, I just want to give you thanks for this collection of people, for the work that they do, for the service that they do, for the residents that we have. Teach us what it means to be your children, what it means to love life in all of its fullness. We know that in the midst of our community right now, there are some of our teammates who are suffering from loss or suffering from sickness. We'd ask that you'd be present. We'd ask that you'd teach us how to be present with each other, that you'd teach us what it means to be healthy. Teach us to follow you in all of our ways. In your holy name we pray. Amen.
Amen. Michael, thank you very much. Well, over the last 4 years, these town hall meetings have become a bit of a state of the union for the Wesleyan. And as I began thinking about what were the priority items we should discuss, I have to be honest, I was at a loss. Not because there wasn't anything to discuss, but rather because there is so much going on in our world, across our country, throughout our state, and of course in our community. I just felt like the time allotted for the town hall meeting just didn't seem like it would be enough. Now, obviously, this isn't an actual State of the Union, but it is meant to be a status update on the community that is most important to us in our lives, in our work, and the people that we work with. But before we go into the specifics of our community, I do want to mention some of the items that I know that are at the forefront of many of your hearts and minds today. Many of you are veterans, families of veterans, and we have amongst our residents and other teammates, and we know that the withdrawal from Afghanistan is weighing heavily upon many of you. We pray for the 36,000+ veterans who deployed to Afghanistan over the last 20 years, and for those family members who have lost loved ones or who have loved ones wounded or emotionally affected in some way. Despite what occurs in Afghanistan now, we pray that these veterans may know we are thankful for their service. We know and we pray for the people of Afghanistan, those fleeing in fear, for women and families, for those who have assisted Western forces and the minority tribes. And we pray for wisdom for the government and defense leaders as they determine what to do about getting those who helped us safely out of the country. We pray for those also who were in the path of destruction of Hurricane Ida, for those who have lost family members, for those who have volunteered to serve their brothers and sisters affected by this terrible storm. We ask you to protect all of those suffering from the wildfires in the Northwest, to help those who have lost their homes find a place to live, for those who have lost a loved one to find peace in you, to help those injured to heal, and above all, to help our firefighters and emergency services to continue in their courageous acts of service. And of course, much closer to home, but throughout our nation, COVID-19. Something that has never fully disappeared, has continued to surge its way by way of variants into our lives again. As of today, Dallas, Harris, Tarrant, and Bexar counties are listed among the top 25 counties in the U.S. for the most confirmed cases of COVID-19, with Texas having nearly 4 million cases. Now, while most health agencies state that the majority of all cases are the Delta variant, that does not mean that it is the only variant present, nor is it the case that people are not susceptible to other variants. It must also be said that being fully vaccinated does not ensure that one cannot become positive for COVID-19 or spread the COVID-19 virus. I do have updated information straight from today, dated September 10th, and I want to share that information with you about Williamson County. The average rate of new infections for Williamson County is right at 57%. Now, while this is still high, this is actually a little bit of good news, as we are at a record high for all of 2021, just 8 days ago at 80.3%. But for comparison, I will say that at 57%, that puts us exactly where we were on February 3rd, earlier this year. Williamson County now has nearly 57,000 confirmed cases and over 10,000 more probable cases. There was a slight uptick in the number of vaccinated population. 55.81% of the population is fully vaccinated, and 64.25% of the total population is now partially vaccinated, both increases over the last week. According to most recent data provided by the Centers for Medicare and Medicaid Services, the national percentages for residents and teammates is also very illuminating. So for across the nation, residents that are fully vaccinated are at 83.9%, just shy of 84%. So residents in healthcare facilities just like ours, 83.9% are fully vaccinated. For the Wesleyan, as an entire community, we are at 97.87% fully vaccinated, a significant increase over the national average. And how does it break down? Independent living, we're at 99% fully vaccinated. At assisted living, we're a little over 98% fully vaccinated. And at Wesleyan Skilled Nursing, we're right at about 94% fully vaccinated. Do understand that some of the residents and patients that we treat cannot receive the vaccine based on certain medical conditions. So therefore, that's why those numbers change. And it also changes when we have new admissions and we're waiting for information about whether of the vaccination status. Maybe some more important information to you is the recent data from the Centers for Medicare and Medicaid Services about the national percentage for employees that are fully vaccinated. Across the nation, the number of staff or teammates fully vaccinated is 62.7%. This is inclusive of organizations that have instituted a vaccine mandate. The Wesleyan is at 77%, 15% more than the national average. Very proud of this. That number actually increased 3% from the prior week. We do continue to offer biweekly vaccine clinics and are proactively engaged in educating anybody with regards to the vaccine. Now, I have shared with you percentages of this population, percentages for that population, but we cannot look at those that we're serving, our residents and patients, or those with whom we serve, one another, just as numbers. Our workforce, you, our teammates, have been impacted by all of the challenges that I've mentioned above and more so. Early on, we adopted infection control practices with personal protective equipment, increased screening, self-monitoring protocols, in addition to the standard preventative measures. And while I know that you love being a part of this family, it has been incredibly tough and continues to be. I am in awe. I was sharing with some board members in our local chamber how inspired I am by your continual adaptation to new and evolving practices that are changing nearly daily, as well as your endurance, both physically and emotionally. In addition to the increased guidance and restrictions that directly impact your work, like our residents and family members, we know that you are experiencing COVID fatigue. And people that say COVID fatigue is not a real thing, that is not true. COVID fatigue is real. You have experienced it firsthand. People that are suffering with COVID-19, as well as the pain of lost residents and lost colleagues. I've spoken with several colleagues in communities like ours across Texas and across the United States. They've reported that long-term tenured staff have left their jobs, retiring from healthcare altogether because they don't want to have to go through COVID-19 again. And while COVID-19 is significant, it's not the only factor impacting the available workforce. All sectors of business are feeling the pressure of filling open positions. As an organization like ours that calls to serve as passionate teammates like you across the variety of services we offer, we are in competition for staff with most mid-sized and large employers in and around Georgetown and as far south as Austin and as far north as Killeen. It's a challenging time for everybody. We are working closely with a variety of organizations that assist people in job placement. We've developed new relationships with the Georgetown Independent School District to help in the training of students, to help invigorate support, as well as create future teammates. Now, I know an issue that is important to all of us, as well as our residents and family members, is the issue regarding vaccine mandates. As I have shared above, the Wesleyan has made incredible progress with our teammate population regarding vaccination, with very high percentages even outside of a mandate. Now, as you know, we did receive an announcement from the Centers for Medicare and Medicaid Services, CMS, that it was their intent to mandate vaccinations for all employees of nursing homes. You may not know, but our WSN teammates represent the majority of Wesleyan teammates. It is the Wesleyan's approach. I want you to understand, as we are together, that a mandate for one part of the campus will be applied to teammates throughout our organization. The team at the Wesleyan continues to work and revise policies and procedures for the rollout of the vaccine mandate. Initially, this was intended to come out in late September. CMS expanded on who will be covered by that mandate in an announcement yesterday. They've expanded that mandate to include hospitals, dialysis facilities, ambulatory surgical settings, home health agencies, and anecdotally in their conversations, they said anywhere healthcare workers may be employed, among other sites. We know that that definition is going to expand. We were told this week on a phone call with the Department of State Health Services by Dave Gruber that DSHS is already looking at how they're going to apply this nursing home vaccine mandate to their other licensed areas, inclusive of assisted living. In addition, President Biden began his comments to the nation at 4 p.m. yesterday during his briefing with the following guidance. He said that he is instituting a Department of Labor emergency rule to require all employers with 100 or more employees to ensure their workforce is fully vaccinated, or at least show a negative test once a week. And this will be in addition to the mandate and guidelines required by CMS. So what does that mean for us? At this time, we do have a COVID-19 vaccination policy that we will be releasing. We have established medical and religious exemption review committees that will receive now created request for medical exemption forms and request for religious exemption forms and determine if we can honor those exemptions and if we can make accommodations for them. This will also include a timeline for announcements, deadlines with regards to vaccinations per type of vaccine, and other types of milestones related to this policy shift. Understand that the mandate that we talk about will relate to only vaccines that have been removed from the EUA, meaning right now the vaccine to be required will be Pfizer. At a point, if and when Moderna and the J&J vaccine are removed from the EUA, we will consider them. But in the meantime, it will be required to be Pfizer. This is not a simple do or don't do decision. It impacts practices across our continuum of care. It requires revised policies and procedures and practices, and it will definitely impact existing as well as future workforce. But more importantly is that this type of a change directly impacts our lives, your lives. We are working diligently to understand the consequences of this mandate and these other changes and these emergency rules. We're also trying to anticipate the unintended consequences that frequently come from these kind of policy directions. The Wesleyan will be requiring newly hired employees to be fully vaccinated before being offered a position and assuming a work schedule within our organization. This will be effective as of this coming Monday, September 13th. We know that the mandate guidelines from CMS have not been fully expressed, and that interim and full rule will come in October. However, we only feel that it's fair that as teammates have to give 2 weeks or 30 days notice, that they be aware of the direction we're going so that they can make decisions. We know this is a highly politicized issue, but for us, this needs to remain an issue of safeguarding our residents, our family members, you, as well as our volunteers and contractors and others that work with us. This decision comes with additional burdens for all of us, as it will undoubtedly have a significant impact on an already challenging workforce environment. Now, the Wesleyan is engaging in these policies that will further support you, our teammates across the campus. This includes support for those who are found to be positive for COVID-19, as well as other incentives for their work during these times, such as the retention bonus that was mentioned earlier this week. I will tell you that our Board of Trustees and our family members and residents were pleased to hear that we are taking these efforts, and we hope that you are too. Changes in the infection rates locally, new policies from healthcare agencies, and other issues related to the pandemic may require us to take a step or more back before we move forward again, but we're going to do it calmly because we have learned and we are going to continue to learn. We are learning together. We'll continue to change our practices to include whatever makes the most sense with that focus of safeguarding you and our residents and families. Now, I know that this is a lot of information. I know there's some other questions, and we're going to get those to the end. And we know that COVID-19 has not ever gone away We don't know when it will go away, but it is also not the only thing that defines us. We have strong operations. One of the greatest concerns expressed to us from residents and some of our teammates is how we are doing from the standpoint of census and residency throughout this pandemic. Well, we looked back for 1 year. Our independent living has increased from 91.56% to 96.48% due to the efforts of many of our teammates. Our cottages remain 100% occupied. Assisted living was a very interesting percentage in the sense that 1 year ago it was 94.4% occupied, and when we took this measurement, it was again 94.4% occupied. The census mix was a little bit different, but staying strong. Now, I want to share with you that WSN, Wesleyan Skilled Nursing Rehabilitation, has reduced a little bit from 84 to 76%, but I want to share some background information with you rather. Before we acquired that building and it was operated in a for-profit, it had never exceeded an occupancy of 50%. Intermittently, perhaps from time to time, but overall, a very low percentage. And then, of course, we filled it to the maximum when we transferred residents from our scenic property. But you also need to understand that there was a substantial increase in skilled services, which means we're helping people with greater acuity. But the decrease is not just as a result of decreased interest, but it's rather limited because of the admission regulations that we have. We can't admit all patients into dual occupancy rooms. So all the efforts that you're taking, all the work that you're doing, in fact, we know that the hospitals and discharge places want to be able to discharge to us, but we are limited, effectively reducing some of our bed availability by half. And it's the case that COVID-19 has had an incredible impact on reducing the number of elective surgeries, which has reduced some of the people coming in for skilled services. I will tell you our home and community-based services programs, our home health, hospice, and personal assistance services has continued to flourish, enabling us to reach more people, not only in our community, but beyond the limits of our campus. We are working on our budget process for 2022. It seems like each year we start a month earlier than the last, but each year the process has improved. It's also identified for us opportunities to be more strategic in our budgeting, which has allowed us to manage well during these very difficult times that everyone has experienced over the last 19 plus months. You may know as well as us, as we look across this state and the nation, there are organizations that have shut down wings, shut down buildings, sold their campuses. That's not been us. We have remained strong because of your work, because of your quality, because that attracts people to want to be here. That makes us strong. We have been asked whether or not there will be increases this year. And you know, and when I say increases, I talk about rent increases, because you know that oftentimes you're asked these questions. We were very fortunate to pass a 0% increase along to our residents last year. But cost of living adjustments this coming year are estimated between 5.3 and maybe 7, even as high as 7.3%. This would be one of the highest paid cost of living adjustments since 1983, when it was 7.4%. We do recognize that there are rising costs of wages and benefits, and so therefore we are not going to be able to skip an increase this year for our residents. And while our final percent but for the budget has not been determined, as soon as we do, we'll be sharing that with the residents. And those dollars will go into helping support our teammates in the operations of this organization. Now, it seems a little bit odd, but we are continuing to be involved in strategic planning. It is important for us to be very cognizant of where we are each and every day with the emergent issues that are in front of us. And for an organization that has been here in ministry for as long as we have, we do need to pay attention to the heritage, where we are today, but we also have to continue to look at the future. And so I want to share with you, and for those of you who've had recent new teammate orientations, I talk to you about these things. I talk about it at each new teammate orientation because I want you connected with the services that we offer. So in addition to the property that we acquired along Williams Drive, both the empty property as well as the property attached to Wesleyan Skilled Nursing, we have now acquired another nearly 3 acres and finalizing the acquisition of another 1 acre to expand the northwest part of our campus. This should be placing us right around 54 to 55 total acres, a significant growth from the 40 acres we had just 4 years ago. We are a landlocked property, So the Wesleyan continues to monitor contiguous properties that become available for possible future growth. When we do acquire these properties, it doesn't necessarily mean we're going to build them right away, but it does help us in our planning. We are in the midst of planning for the renovation of our Independent Living West building. Many of the items that we have have been discussed, they have been there for some time, even years before I even got here. And they're going to include handrails, a more common space, and a chapel dedicated over in that area, and expanded laundry services. The interior design firm, which helped us with our updates over at WSN, will be providing design boards for all of us to be able to touch and see and feel so that we can see what's going to go into this renovation. Our architectural firm is reviewing mechanical and engineering plans for across the campus. And we do have a timeline with renovations and bids and issues and permits to be resolved this year so that we can actually begin construction on that remodeling in the early part of next year. Now, many of our residents and some of you have commented with regards to the expansion we're going to be working on and what our overall strategic plan is. So I'm going to talk about this really from a very high level, but to let you know that the strategic plan of our organization still includes the following. And this is one that has not only been approved by our Board of Trustees, but reaffirmed by the Strategic Planning Committee of our Board of Trustees, to include expanding our independent living, both in congregate apartments, like our independent living east and west, as well as cottages. We have expansive wait lists for both of those products. We're going to add an amenity center to include an indoor pool and aquatic therapy and more common space and another meal venue. And these are things that we also want to make sure that we're sharing with you, our teammates. We want to expand assisted living, not only to expand on the common space and just room to grow, but also expand on the memory care units available and offer different services there. The idea is to expand and remodel our skilled nursing to include more units of Alzheimer's and dementia care. And we think it's extremely important to make sure we have the addition of a chapel. We know there's been a room, but we think that a chapel, something at the forefront of our organization, is consistent throughout our organization and something that would be well received by our teammates and our residents and family members. As a part of this overall package, we're going to be adding updated and illuminated signage for our parking, additional parking, walkways, as well as building identification. We'll also include travel and road connectivity, formal road connectivity between our main campus and going back into WSN, as well as from our assisted living back into our new property. Now, this is an evolving plan, which means that as we take on each phase of the project, we will evaluate the needs of the community and those who are in need for our services to establish different or new priorities. As a part of that, we actually, because of your work, because of the incredible work that actually takes place at all levels of care, and specifically through our hospice program, we have been looking for ways to expand upon the abundant life and the continuum care of our services and who receives them. Your hard work brought us to the attention of leaders in the community. Those leaders connected us with a donor who is donating, has the plans to donate to us a significant amount of property to build an inpatient hospice center. We want to do this to not only provide an inpatient end-of-life hospice and palliative care center, but also an education and training center for those that are involved in end-of-life, as well as other programs to expand the Wesleyan ministry. This is not connected to our current property, but it is in Georgetown, and we'll share more information with you as that particular part of our ministry grows. Now, I know that there's a lot of information that I've provided, some of which is exciting about growth. It talks about how healthy we are, but other parts that are extremely difficult to hear. Others are examples of how we're connected with our board and we are moving forward. But at the same time, as we experience COVID-19 and whatever else comes down our way, I've said we may have to take a couple of steps back before moving forward. So as I think about this, Georgianne Hewitt, who's on the screen with us today, was sharing with me some comments from her sister, the Reverend Laura Hewitt Becker, who now serves as pastor of Leander United Methodist Church, but who served as pastor of the First United Methodist Church of Rockport, Texas. And she shared these thoughts after Rockport took a direct hit from Hurricane Harvey about 4 years ago. And I think her remarks are just as impactful to us today. She said, and I made a couple of modifications for us, but she said the disruption to normal habits of work and living weighs heavily on all of us. The myth of self-sufficiency is dispelled by the truth of communal reliance. And that communal reliance is you. reliance upon one another. There are no fences and walls when the loving heart of Christ shows up in the world. It is accessible daily, as close as your and my breath. In the Wesleyan tradition of Christianity, the love of Christ looks like doing good, doing no harm, intending to how you will grow and show your love to God. Following these comments, she referenced Galatians chapter 6, verse 9. Let us not become weary in doing good, the good that you are all doing. For at the proper time, we reap a harvest if we do not give up. And she ended with, keep holding on to that which screams goodness and love in this time of disaster. And I would say this time of challenge. It is the grace of God that holds us all together. So I want to thank you, Wesleyan teammates. You are part of the community. When I say Wesleyan community, that includes you. And I thank you for the good that you all have done, are doing, and continue to do. And we will continue to do that together. We have been doing incredible good for 59 years. Today, September 10th, marks our ministry's 59th anniversary. We have much to celebrate. Yes, we have challenges, but we have much to celebrate. And what we celebrate is because of you and our residents and our family members and our board of trustees and our donors and our community. They know that it comes from you. We've come a long way since the first resident moved into the Wesleyan retirement home on Church Street. We are going to be sharing plans for how we will be celebrating with you our 60th anniversary in upcoming meetings, town hall meetings, and such. I just want you to know how thankful we are to be with you in this growing and living ministry, and that it has, because of you, an incredible future ahead of us. Now, I've ended other comments with these things, and I'm going to ask them again before we go into some of the questions. I just want to make sure that we say, we ask you for prayers for all of us, our entire community, and with that, grace for others, and for you to be promoters of peace in these challenging times. Now, I want to thank you. I'm going to open up my screen a little bit here to see others that are here. Team, if I can, I think what I would like to do, unless anybody has any opposition to it, is to go through some of the questions that I have been sent. Georgianne, I would say, if we have anybody that's watching live that has some questions. I'm sorry, I'm looking back and forth between my screen and the camera, so I apologize for that, but I'm also not wearing glasses to reflect the light, so I've got to look a little bit closer. But I'm going to ask some questions, but if we have other questions that have come in from our administrators from online, I'll respond to those. I'm just going to read these as these were sent to me. The first one is, will our visitation policies change due to the increase in COVID-19 cases in the community? Yes, they will. They have. They have before. Now, will they be the exact same change in policies? I don't know. We were very successful. You were very successful in those modifications, but times are different. A year ago, we didn't have vaccines, or they weren't as prevalent, and we had different things going on. So I think the answer is, in general, is yes. And we've learned from them, and so they're likely to be modified, but we're going to continue to be in communication with you about them. Let's see. I'm going to save that one because it actually goes with another question. Since there is only one entrance and exit to the building, I think what we're doing is actually, I guess this really would apply to all buildings as we kind of narrow things down to individual spots. Can we move the time clock to be at the front of the building and be more accessible? I think that's a great idea. The first thing I would tell you from the standpoint of technology and how those things are mounted and so on and so forth, I'm probably the worst person to talk to about that. If you want me to delve into a computer, I'm happy to do that. But so I think what I would say is I would ask our administrators. This seems like a request that makes sense. There's a physicality of location. There's connectivity. There's a lot of different issues. So what I would ask our administrators is to work with your directors of facilities, with Mike Parker and others, to see how that could be accommodated, to either get it up there or as close as possible, or whether it's temporary or permanent, and let's see what we can do. And what I would ask, I know we have meetings every week, if we can get that information as soon as possible, let's see what we can do to facilitate that for our teammates. Now, some of these questions are not COVID related, but I'm just going to read them in the order that I got them. Will we have a different option for health insurance next year? These questions have been asked a number of different times from a number of different perspectives. The first thing I will tell you is I am happy as an organization that we can provide health insurance. I think it would surprise many of you to realize that there are a lot of organizations that don't provide any health insurance. I know that sounds odd. That's never been something that I've been supportive of. Some organizations do it because they have investors that they have to pay money to first. Others do it because they can't afford to do it. Now, all of that being said, in 28 years and having been in health insurance programs, both that are self-funded, completely, fully funded, privatized, very open, very narrowed, all of them are challenging. All of them are challenging. So when you say there are difficulties, I believe you. I will tell you personally, I've had difficulties navigating our health insurance. One of the reasons why we pay for Patient Pal, which is a patient advocate and navigator to help people really take on some of those challenges for you. That's a service that we pay for as an organization. So if you don't utilize, I highly recommend that you find a way to use it, talk with HR and others who might utilize it. I use it frequently. In fact, we were processed an invoice as a family member, and they said, we went to a clinic, and they said, oh, you're not covered. And we went to the exact same clinic in a different neighborhood, and they said, oh, yeah, you're covered. And so we had to go back and have Patient Pal then go and get those dollars for us. So I know it's challenging. Now, to answer your question overall, we look at health insurance every single year. So are we married to this particular health insurance policy? No. We do have an obligation, this one, I think, to carry out 3 years, which will be through this next year, 2022. So we will be going into open enrollment in this fall with what we have. Some of it may change. We don't know that yet. We're getting that information. I think it behooves us to make good decisions, to hear from you about what is good and what is not good. And so that when we go out and shop for it, that we're looking to answer all of those questions. We want good health insurance, but we also want it affordable for our teammates. And the more affordable we can make it, the more we can take on as an organization to help pay for. And we do pay for a significant portion of not only our employees, but also with some of our dependent care as well. So it's a good question. Continue to give us feedback. We are fortunate to be able to continue to provide health insurance, not a perfect system, but give us feedback so we can help continue to refine that so that is a benefit. What is and let me pause here to say, I'm going to give you these answers, and I know we have some limited time, and if you don't get all of these questions answered or you want more details, come back and ask us questions. We'll respond to them. We'll get them to who we can to get those responses to you. What is the deadline for all team members to get vaccinated? Well, we are not sharing that information and deadline today. We do have a tentative plan, as I've shared with you, in place and ready to go. We are still waiting for some clarification now from a number of different places, not just CMS, but the Department of Labor and OSHA and the Department of State Health Services. I mean, when we're in the industry we're in, we are regulated and touched by. I mean, look at the faces that are on the screen here, and it's funny because when you say regulatory agencies, all these eyes light up, you know. I mean, and it's accounting practices and federal guidelines and banking processes and more acronyms than you get. If you have the alphabet in front of you and you just word jumble it, there are agencies that represent all those word jumbles and letters. So, but the reason why we're waiting is because we don't want to have to implement a policy and procedure and then immediately find conflicting guidance and then have to re-roll out something in a new practice, a new education stuff. But we know that we're going to have to move some things forward. So we're not going to be able to avoid that entirely. We anticipate, in addition to the new higher vaccine mandate guidance that I've just shared with you that'll start this coming Monday, we anticipate that guidance going out this coming week. And we will be communicating to you how it's going to work, what's going to take place. And as the coronavirus is a novel virus, these are novel policies and procedures. So we're doing everything we can. What I can guarantee you is they're not going to be 100% complete. We're going to have to get feedback. We're going to miss something because we're human beings working with human beings. So bear with us. But we want your feedback so that we can make sure that these roll out and are communicated to you well. If something is missed, it's not an intentional miss. It's not to carve somebody out. It's because we're still working through it. Please be patient with us as we're patient with you and we roll these things out. Next question is, if we refuse to get the shot, could we give our 2-week notice up to the deadline? Well, again, our policy and procedure for how we are managing the vaccine mandate has yet to be implemented. Therefore, I can't necessarily give a response to that. I can't speak to every possible circumstance that might be out there. I will tell you, we want you to continue to be a part of the Wesleyan family. Our residents and patients want you to continue to be a part of the family. We want to be able to educate you about these decisions and clearly the direction of all healthcare, especially the field in which you've chosen. And when I say healthcare, I don't mean just clinicians. I mean those amazing teammates that are in dining services, that are working with people that are compromised, those people that are beautifying our grounds, taking care of the air conditioning units, repairing tile, processing invoices, doing marketing, providing activities. All of you work with people who are potentially compromised. And I will be honest with you, some who you think are not are. And so think about that, please. So I'm just going to choose the fact that I don't want to have that conversation about people leaving because they don't want to be a part of these policies. Because I want people to be able to make that decision. If you do, we will respect it. But we are going to enforce these policies and move forward for the protection of you, our teammates, our residents, and all who come here. Now, another question, is the Wesleyan or whoever is held responsible if I take the shot and become ill or have serious side effects and can't work? Let me share something with you. We've talked about health care. Individuals' personal and medical responses to any treatment is just that. It's individual and personal. As with any treatment, we would highly encourage you, all teammates, anybody, to consult with their primary care physician or whoever you receive guidance from to understand the treatment you're going to receive or consider. As I've stated above, we don't have any guidance from CMS or others with regards to the vaccine mandate at this time, and therefore cannot speak to how their emergency policies will address or provide guidance regarding loss of work time and as a result of the required vaccination. We ask you to go in this educated. We're happy to educate you as best we can. There are a lot of resources for that. There are some supportive things, like we've talked about. The ETS is one of those. And we'll work with you. Of course, people also have PTO and catastrophic sick time that people can have access to, and we'll provide guidance where we can. Here's a pretty tough question. So what is the purpose of getting the shot if you can still get and spread COVID-19? Well, it was followed by comments saying, we were told that you can't. Well, that's not true. We were told that you can't get COVID-19. Well, that is also not true. Percentage of effectiveness can be strong and varying, but the issue is that's never 100%. So I'm going to read some things to you. COVID-19, this is straight off of CDC. COVID-19 vaccines are effective at helping protect against severe disease and death from all variants of the virus that causes COVID-19 currently circulating, including the Delta variant. COVID-19 vaccines are effective at protecting you from COVID-19, especially from severe illness and death. COVID-19 vaccines reduce the risk of people spreading the virus that causes COVID-19. If you are fully vaccinated, you can resume some activities that you did before the pandemic. Studies show that COVID-19 vaccines are effective at keeping you from getting COVID-19. Getting a COVID-19 vaccine will also keep you from getting seriously ill, even if you do get COVID-19. COVID-19 vaccine teaches our immune system how to recognize and fight the viruses that cause COVID-19. It typically takes about 2 weeks after vaccination for the body to build protection, immunity, against the virus that causes COVID-19. That means it is possible a person could still get COVID-19 before or just after vaccination, and then get sick because the vaccine did not have enough time to build protection. People are considered fully vaccinated 2 weeks after their second dose of the Pfizer, BioNTech, or Moderna COVID-19 vaccines, or 2 weeks after the single dose Johnson & Johnson's Janssen COVID-19 vaccine. Millions of people in the United States have received COVID-19 vaccines, and these vaccines have undergone the most intensive safety monitoring in U.S. history. These are direct quotes from CDC. This monitoring includes using both established and new safety monitoring systems to make sure the COVID-19 vaccines are safe. COVID-19 vaccines cannot give you COVID-19. After COVID-19 vaccination, you may have side effects. These are normal signs that your body is building protection. Side effects from COVID-19 vaccination include but are not limited to tiredness, headaches, chills. It may affect your ability to do certain daily activities, but they should go away in a few days. And you need to confer again with your primary care physician. Those are straight from the CDC. These are the resources that are available to us to provide to you. And I know I don't need to read to you from websites, and I know there are other sources that people come to. Please check your resources. So, other questions that have come up in recent months have been, why can we not give visitors or mandate visitors N95 masks? Why do visitors not have restrictions, but teammates do? That is an excellent, excellent question. Now, as a business, and we are a business, we're a nonprofit, faith-based organization, something I'm very proud of, but understand we are in fact also a business. And we have far more freedom to enact policies and procedures that impact our teammates and employees' contracts than we do our clients and visitors. It's a different population. In fact, as a government subsidized entity, we have far more restrictions placed upon us to regulate our staff than our visitors. Now, an example of that is something that's been brought up, is how our staff have to show proof of negative COVID tests, the vaccine mandates, share information for screening, but our regulatory body has prohibited us from doing that same thing for our regulatory employees, for surveyors, and for organizations that are meant to be advocates for our residents, such as the Ombudsman program. And I'm not calling them out specifically, those just stand out as ones that we work with. And it doesn't make any sense. It doesn't make sense to me. It doesn't make sense to you. It is 100% a contradiction to the guidance that they have provided to us as operators, as the people that are bedside. Unfortunately, it's one of those circumstances. It's a little bit of, if you've ever been a parent or a child, that do as we say, but not as we do kind of thing. It doesn't make it easy. It doesn't. But it is where we are. For me, I would say this kind of reckless policy that from administration is a complete disregard for the safety of our residents and our teammates, and it's shameful. It's one of those areas of political advocacy that our state association and I have attempted to address with Health and Human Services Commission, Department of State Health Services, as well as our local legislators, none of whom have addressed these real concerns. And we are going to continue to ask them because we do think that they are important. And as I shared with you before, we have to give grace to others, and we have to be promoters of peace, which means we can educate and guide and support and encourage. It does not mean that we're a rug to have feet wiped on and that we're going to be berated or abused for what we do to protect other loved ones, their loved ones, and each other. Why are people who are vaccinated and exposed to COVID-19 still able to work if they can still get COVID-19? Well, the Wesleyan follows the guidance provided by HHSC, state and local health agencies, the CDC, and many other regulatory bodies and health agencies for who can and cannot work and when they can return to work in relation to the pandemic. Now, I believe my comments above have addressed why those that are vaccinated are able to resume some duties. And I know if you have more questions we can ask, I know Kelly Getz in our compliance department and others, our administrators can share that. But please understand that exposure does not equate with infection. Exposure and infection are two different things. In addition, our infection control practices, such as the use of personal protective equipment and preventative measures, are proven to safeguard residents and teammates. It's not one or the other, it's both. Another question, why can we not work from home? Or will I be able to work from home if I get COVID-19 and can't work? Or can I work from home if I have a family member who needs care and has COVID-19 and I need to take care of them and work from home? Well, some of these are contradictions. It's hard to take care of somebody at home and take care of somebody who needs somebody from home and work from home. Those things would overlap. But I would also share with you that the overwhelming majority of jobs, really, if you think about it, 100%, but certainly the overwhelming majority of jobs in this organization require interaction with our clients, patients, residents, family members, or teammates, or both, or all the above. In addition, the resources, equipment, environment, technological safeguards, and liability associated with the work we do are covered in what is traditionally the workspace, typically defined by our facilities. Now, the people that we are here to serve and those that we serve with count on us to be here each and every day. Working from home, while it can be possibly convenient, causes a significant disruption to the care and services that we provide. There are a handful of teammates who, if we and it would require a modification if we modified their job responsibilities, could be plucked out and have limited to no interaction with some others in the course of core elements of their job. But again, it would require significant changes and modifications and accommodations that would have a negative impact on care and services. So, as we look at exemptions that may be asked for, exemptions are not the same thing as accommodation. There may be an exemption for something that we cannot make an accommodation for. There may be some accommodations. We don't know. We are going to be dealing with that on a case-by-case basis. But again, I want to reference back to all of our jobs. We are here in service to others and to be in service with people who here are working. And we need to be here for all of them. Now, this isn't so much of a question, but it is a statement. Every single person on this screen has said it, and I have heard it from others. And it is this. In general, we, the teammates, are tired. And I'm going to say again, COVID fatigue is real. And it's really more than just COVID fatigue. It's policy fatigue. It's wanting more staff fatigue. It's why is the community doing this fatigue? Why isn't the community doing this fatigue? Why is the school doing this fatigue? And other fatigues. And this is especially difficult on our frontline workers. And that includes, again, all of our workers, not just our clinicians, all of our workers. We have teammates that have a lot of anxiety about the rising COVID numbers, and that's extremely understandable. There are a good number of people with family members and friends who are or have been sick, people who are mostly okay about not getting in debates, and they've done a good job of not having those comments, but others who have. Concerns about vaccines and what they mean, and whether or not their loved ones can get it or not, or the time away from work or not, or being able to be heard, just to be heard about the concerns they have for themselves and others. It's not always a judgment. Sometimes it's an opinion, and that's okay. And really, the preponderance of you are maintaining a professional about discussing this at a level that is unbelievably incredible, more so than I've seen in others. And some of you have mentioned others that have not. But you're trying to work with them, and for that, I thank you. I think asking good questions is always a good thing. It means you're questioning. It means you want to know. It means you're trying to improve. I'm glad that the debate is staying out of the hallways, but I know it's still there. Our teammates, our entire they need to know that we can't change or make accommodations just for one person without considering the impact or availability for all teammates who might ask for similar or same reasons. What you might consider a priority may not be considered a priority for someone else. And something you think is like, oh, it's not that big a deal, may be extremely important. And both of your perspectives are valid. We're doing our best to be fair in a world that isn't fair. We're doing our best to apply practices and recognize our teammates for all that they are doing. Can we do more? Yes. And we're going to try to do more. So I want to make sure that these are questions that are asked. I'm sorry, there is one other one. Are we going to consider bringing back the shift differential? I asked for some clarification because I think the question I was thinking, is this about COVID-19 or just the regular shift differential? So I'm just going to go ahead and answer both. We have talked and we've used COVID-19 differential before when we've had outbreaks. I think that's always something that we would consider, and we have to look at the circumstances of the environment in which it takes place. guidance and the resources available to us. With regards to just a general shift differential, we've had shift differentials in the past. Some people didn't like shift differentials because when they got overtime or they went to another area, the shift differential didn't follow them. And so by molding the shift differential into their base rate, their benefits, their PTO, their retirement, everything got paid based on that. Some people would like a shift differential instead of. So, we did get this question, and we're going to talk about it. Another question came up was, can we get pay in lieu of benefits? That is a discussion that comes up every single town hall meeting. And I'll be honest with you, has come up for the last 28 years in my career. Some people think that it's wrong, even discriminatory, not to offer benefits. I do feel strongly about people having access to benefits, but I also understand sometimes it's just better to have the money in their pockets. Again, whatever we're able to do, we have to make sure it follows the law. It has to be non-discriminatory. It has to be accessible to all of our teammates regardless. So we have to work through that. We'll ask those questions. I don't know the answer to all those questions today, but we will ask them, and I appreciate those questions being asked. These were some tough questions. I had a couple of teammates said, well, we sent you some questions to one of our administrators. We know you're not going to bring them up. Or, Kate, I think I asked and answered every question you sent me. Okay. I don't believe I got questions from other people, from teammates, although I did answer some of them in some of our other town hall meetings. I'm going to pause for a second. So whether online or from our administrators, are there other questions that I can answer while we're on screen?
So Mark, we did have one question online, and you covered it to an extent, but I think it's a great way to reiterate that we're going to be communicating all of this over and over and over through different channels. The question was, as of right now, are vaccines being made mandatory for Wesleyan employees?
Okay, so it's 9:52 a.m. on September 10th. And as of this moment, that policy has not been implemented. And it is going to be implemented and likely to be implemented this next week with all of the requirements that'll come along with it. To answer some questions that perhaps go along with that is, will there be time given? Yes. Will there be a review given to exemptions? Yes. Are there committees set up to review those exemptions? Yes. Has the policy been created in consultation with legal services, in guidance with regulatory bodies? Yes. Will it be the last revision? No. Right now, I was talking to Kelly about this earlier. Right now, the vaccine mandate is going to have to be limited to the Pfizer vaccine because it's the only vaccine that has been released out from underneath the EUA. If at some point in time, and I believe that it will, but I don't know today, it's now 9:53 a.m. on the 10th. I don't know when Moderna is going to come out from underneath the EUA. I don't know where the Johnson & Johnson vaccine will come out. When they do, we'll consider it. But in the meantime, it'll only be the Pfizer vaccine. And so therefore, to be compliant, we have to use the Pfizer vaccine. And an element of the vaccine, the mandate process, which includes the vaccine mandate for new hires, that has been announced and will go into effect Monday the 13th. Again, that's to be considerate of any future teammate who may be applying for a position. We want them to know that we're going this direction before they make choices about making a choice to come to us from some other place. I hope that answers it in total. I know there is more information such as what are those dates? When does it have to be done? And what do those forms look like? And again, we'll be rolling those out this next week. We will have them on our website. We'll be informing the administrators. We will be posting it to our website. All the things that we do. I think if you're like me on Kronos, you get an email and 2 texts and everything blows up and it rings and dings and everything else. That notification will come out. We're going to make it but if you don't see something, ask your administrators. They know. Okay? I hope that it honors the spirit of that question. Okay. Any other questions? administrators and leadership team, any other questions that I can answer?
Mark, I know Kelly and I talked a little bit about this yesterday. This is Michael, by the way. I know Kelly and I talked about this a little bit yesterday, but what is the discussion in relationship to boosters for residents as well as for staffing, particularly those frontline staff who might be interested in that?
Right. So I'm not a clinician. As an administrator, I've learned about healthcare things, and I can use healthcare words. So I may punt to Kelly here in a moment. But first of all, the thing I want to make sure we're clear about is an additional dose and a booster shot are not the same thing. And Kelly will probably explain a little bit of that. What I will say is right now that additional shot is for those that are immunocompromised and such. From the standpoint of the organization from operations, when booster shots are made available in general or to healthcare workers, and I consider us all healthcare workers, I want us to have the benefit of it. When they're available, we will endorse it. We'll make that a part of our clinics. Kelly's already in relationships. We'll have policy and procedures. I do believe from that particular standpoint, what I have heard anecdotally is that those that who got the Pfizer, it has been recommended that you stay within the family of your vaccine. So if you received Pfizer initially and you're fully vaccinated, they say that you should go and continue with Pfizer. If you received Moderna, you should stay along that. Different guidance may come up. So I don't think I've butchered it, but I am going to ask Kelly if she doesn't mind to come on screen and maybe just do a little bit more clarification than I've provided. But Michael, I appreciate that question. Kelly?
Hello, everyone. So we discussed it yesterday, and there is some confusion regarding the additional shot versus the booster. We do have vaccines in stock now for the additional doses that we will be advertising for both of our teammates and our residents. But to get the additional dose, you have to meet a certain criteria, and that there are certain things. If you're immunocompromised, you're receiving cancer treatments, taking medications that are immunocompromising medications. So there is 5 criteria and an attestation to receive that additional shot. The booster, the advisory committee met with CDC this week, and they are not planning to make any announcements regarding the booster for the next couple of weeks. So what the booster will be right now, tentatively, it would be 8 months after your second shot that you received. And like Mark had mentioned, it is recommended to receive the same one. So we do have both vaccines in stock, and we will be preparing to set those clinics up in the future. We already have a timeline of who would be eligible to receive those booster shots from HR. So just be on the lookout. We're doing our clinics every couple of weeks. We actually have one next week, and so information will be going out on that clinic. So if there's anyone in you or your family members want to join those, I'd be happy to see y'all there.
Kelly, thank you. I appreciate that. Michael, does that answer your question? And as we receive more guidance, we will provide more communication.
Yeah, I kind of understood most of that up front, but I think it was an important question to have others on page with to hear as well.
Great. Thank you for asking that. Other questions? Anything else online? Administrators, I'm kind of looking around the screen at you. Eva, you raised your hand. Yes, Eva.
I did. Sorry to bother, but I had a question from a teammate indicating whether or not during an interview, if we would be allowed to ask an interviewee whether or not they're vaccinated. And I think the answer is yes, if that's going to be a part of our policy beginning next week. Is that correct?
So we will share that a stipulation or requirement of hiring will be to be fully vaccinated. So the question, I think the issue becomes up is that a PHI issue? We're asking about a health condition and things like that. It will be a stated requirement for hiring, and so that question won't have to be asked. The teammate, the potential or prospective teammate, will have to identify that they are able to meet all requirements of the position. So there are a lot of different requirements. This will be a universal requirement of have to being fully vaccinated to come into the position. So you're talking about new teammates, I'm assuming, or potentially new teammates. So they should review the employment requirements, and they will, by making application for the position, both agree to them and then have to show proof. For instance, if I were applying for a certified nurse aide position, I would have to show proof of certification. There'd have to be background check on an employee misconduct registry, things of that nature. In this case, I would have to show proof of vaccination prior to being hired. That's not a specific answer to your question. If you're specifically asking if verbally during the interview someone's going to ask, have you been vaccinated? That won't be necessary. That will be listed in the requirements as a bona fide requirement of the position's hiring.
Okay. And so the second part of the question from the teammate was also, if not vaccinated, will they have to wait 2 weeks until fully vaccinated before they can start? And I think the answer is yes, because they would have to say that they are able to meet all the requirements of the position.
So this is a teammate asking on behalf of another person who might be a future teammate. That's a great question, and I don't know that we've worked that policy out. We understand these are challenging times. I think we have to look at that on a case-by-case basis and look at what we can and cannot do. The vaccine mandate's coming down. Obviously, we will have this mandate for new people coming in. I think it depends. If a prospective teammate shares with us, say, let's say it's me, and I'm like, I'm coming in, I'm a wait staff, and I'm like, yes, actually, I just got my first dose, and this is the case. That will be reviewed to be dependent upon when a person gives notice and when they will start. If it's a day or two, we'd have to look at that. When does their schedule start? So they may not have to start late. It might line up perfectly. It might have to be delayed within the regulatory guidelines and how this policy might roll out. It could be that there's some overlap because that first day of orientation, you can be separated, have an N95, be 6 feet apart, and so on and so forth. So I think that's dependent, but I think they're good questions. And so that as our teammates, and I know a lot of our new teammates come from referral from existing teammates, and that's wonderful, is I would have them ask those questions. There are so many different positions. A person who might be coming in, let's say, part-time, and it won't be until the weekend, and it can be delayed from an orientation, might be one thing. But a person who's coming in, and let's say that's a driver that's in a confined space with our residents driving from WSN, that might be a different circumstance. So great question, and I would have them ask that question. There's no one universal response for everybody.
Yes, sir. And then one final question that I received, if I may, is whether or not, for clarification, whether or not Pfizer is the only approved vaccine. And I do believe that you indicated that anyone that is fully vaccinated, it can be with any of the series that have been available. However, moving forward with the policy to be considered fully vaccinated, is it only Pfizer or will still?
Yeah, so those are great questions. And again, I may rely upon Kelly here, and I'm going to shoot a little bit from the hip there, because I think there is some clarification needed in that. Do we as an organization recognize the use of Pfizer, Moderna, and the J&J as being fully vaccinated? Absolutely, we do. Absolutely. Those are CDC, go online, and they will tell you those are absolutely proven vaccines. Now, it is the case that Moderna and the J&J Janssen are still operating under their EUA. The Pfizer is not. So for teammates that would come to us under the mandate saying, I'm being mandated to get it, we will provide we can provide whatever, but with Pfizer under the mandate, I think our greatest comfort is to provide that because we know that it's not operating under the EUA. Now, if I were up to now an unvaccinated teammate and I wanted to go get the vaccine on my own, and I chose to get the J&J or the Moderna to be compliant, that is 100% up to me. I'm not going to be dictated to by who that's going to be. And so to be compliant, if you're asking, if I came to you and then said, okay, Kelly or Eva or whomever, here is my status. I've just now received my shot of J&J. I'm now going to be fully vaccinated in 2 weeks. Is this compliant? The answer is yes. If we're providing it to a person who is keeping their job from the standpoint of mandation, we are going to provide the Pfizer or any vaccine that has come out from under the EUA, so that if tomorrow or this afternoon Moderna and J&J were to come available, if we have them available, and we really only had the Pfizer and Moderna, if we had them available, then we would provide a choice. So maybe that's a little muddled. I hope that answers your question. So a person can make a choice. If they're asking it for us from the mandate, we will use Pfizer. If they have difficulty, I think sorry, the lawnmower's going by. If I have to, I have to think about, and I'll talk to Kelly and I'll get some guidance. If a teammate says, I would prefer the Moderna, I mean, everybody has to sign waivers and everything else like that to begin with. I have to find out whether or not, under a vaccine mandate, whether or not we can provide the Moderna. I don't know that answer today, but I will find out, because I do know some people choose one versus the other for the research that they do. And also, I'm sorry, Kelly, I think Mamie, I did see your hand, so I'll come back to you. Kelly, I believe it's been the case we've been able to have access to Moderna and Pfizer, and as a facility in provision, we've not been able to get the J&J. Is that correct?
That's correct. Mm-hmm.
Okay, that may change, but it has not changed. So, Eva, does that answer that question with the caveat that I have to find out another answer?
Yes, sir, I do believe it does. Thank you.
Okay, thank you for asking this question. Mamie Lister, I saw your hand raised.
I've just gotten a question. If
Yes,
an
ma'am.
individual accepted a position this week and has resigned their current position elsewhere, and we find that they are not vaccinated, would they be grandfathered in as all other teammates, and then we would get them vaccinated?
Gotcha. It's an excellent question. So since the mandate for newly hired teammates starts effective Monday, and really what that means is, because orientations are Tuesday, that's when job offers are either offered or extended or accepted. As of Monday, they will have to show proof of vaccination. So the answer to your question is, let's just say, for sake of argument, Donna is offering a position to someone and that person calls back on Sunday and that position on, they're accepting it, then they would fall under all the rest of us. So if I've been here for, let's say if it's Sunday at 11:59 p.m. And I've been here 20 years or 20 weeks, or offered the position 20 seconds ago, then I would fall under as an existing teammate. Everybody from the 13th on will be considered newly hired teammates and would fall under that mandate. Does that make sense? I know that sounds weird and bizarre, but with timing being what it is, I think it's best to just kind of have that line of demarcation, and that's where we feel like that's fair. Because I think to treat them any differently, I don't want that to be a bait and switch. I want them to understand that, because that does make a difference. Thank you. Any other questions, Mamie, for you? By the way, Mamie's question, you know what? I should repeat that, because there was a little bit garbled. She was asking is, for teammates that are hired prior to the mandating of the newly hired vaccine mandate, will they be treated as existing teammates? And the answer is yes, they will be treated as existing teammates. Other questions? These are good questions. Okay. Sometimes, sorry, George, I'm going to check in one more time. Any online questions? No. Okay. Sometimes people don't want to ask questions in front of others. Sometimes people are afraid to ask questions online because their name ties up. They didn't quickly put up something like anonymous person 1234 so they could ask a question without it coming back to them. And I get it. Some people feel like there's retribution for asking questions if they feel like it's not conformity. I'm going to tell you, people, when they ask, are you pro-vaccine or anti-vaccine or pro-mask or anti-mask, I'm going to tell you is, I am pro-Wesleyan community and what makes you healthy and safe. That's what I want. These are tough decisions. These aren't decisions that are made in an office by yourself. Sorry about the lawnmower. This is made with everybody. I know that these decisions from the past and decisions from the future are not going to make everybody happy. I have two teammates this morning who sent me texts early this morning and said, I'm supportive of what you're doing, but I don't agree with it. And I appreciate that. And that requires a lot of strength and courage. And I value it. This organization, if nothing else, from since I've come on here, I have been made stronger by you who've been able to voice opposition. I'm not going to be, nor am I ever going to become the person who wants people who just agree. I want to hear about difference because it has made a difference. My mind is changed quite frequently by others. I think it's important because we are a community. It is different to be in this role than to be the nursing home administrator, the executive director for home and community-based services, the leader of an independent living, the director of assisted living, chaplain, finance, development. Wherever it is that you work, it is different, but we all serve a role. All roles are important. Our residents, patients, and this community rely upon each one of you. Now, I've been a certified nurse aide, and I have been a nursing home administrator through what at the time was difficult times. These are difficult times. And when we come through this, there will be difficult times in the future because we are people caring for people. But I've never been more proud and a greater sense of confidence because of the people that I pass in the hallways and how you can see them smile with their eyes behind their mask. Because there are teammates that ask about the residents and how they are doing. Because there are residents and family members who intentionally ask about our teammates. That's why I'm confident. All the rest of it is politics and anxiety and fear and drama making. And it's not going to go away, but we can choose to rise above it. So I want to say thank you. From me, thank you. It is an honor to serve here. It's a privilege to be here. I know our other teammates feel the same way. If you disagree, please share it with us. We want to hear from you. Thank you for taking the time to be with us today. I know this is a lot of information. Thank you for what you do each and every day. It makes a difference. God bless.